Okay, before I get started with my patient, I'm going to check her orders. My patient is Miss Sarah. She had a spontaneous vaginal delivery about 4 hours ago. She was given an epidural. She had a second-degree laceration, and she was given Tylenol 30 minutes ago. We are just going to go in, and the doctor's orders is just a postpartum assessment. So I'm going to wash my hands, gather my supplies, knock on the door. Hi, Miss Sarah. My name's Caitlin. I'm going to be your nurse today. I'm going to provide some privacy. Can I just have your name and date of birth, please? Perfect. And while I'm doing this, while I'm coming into the room, I'm looking around. I see baby and husband are here. Mom's happy. She's smiling. Her general appearance is good. She's not struggling to breathe. She has good color skin. She's conversating with her husband. So everything seems good. Miss Sarah, we're just going to do a postpartum assessment on you. It's only going to take me a couple of minutes, and we're just going to make sure everything's going smoothly. Is that okay? Yes? Okay, so I'm going to raise the bed. Sarah, before we get started, can you just tell me the last time that you went to the bathroom to pee? She said about 3 hours ago. All right, great. And have you noticed any changes since since I was last in here? No changes. Okay. And Sarah, are you breastfeeding the baby, or are you doing bottle feeding? She says that she's breastfeeding. Okay, perfect. First thing I'm gonna do then is I'm gonna check her vital signs. So get her temperature 99. I'm gonna get her blood pressure 120/78. Her respirations are good. They're about 13. I can check her heart rate, and that's about 80. And I'm gonna ask if she's having any pain. Are you having any pain? She said that she's having just a little bit of pain. Where is the pain located? Where her lacerations are. Okay, we can take a look at that. So now I'm going to start. Is it okay if I palpate your breast? Since she's breastfeeding, I'm trying to make sure she doesn't have any clogged milk ducts or any swelling, redness, anything like that. And then I'm also going to be assessing her nipples. So I'm going to just pull her sheet down and then take my hand. I'm just making sure her breasts are soft. Yeah. Do you have any pain when I do this? No. Okay, and her breasts aren't engorged or anything like that. Also looking at her nipples, they're not flat or introverted. They look great. Are you having any pain right now in your nipples? No? Is the baby latching on okay? Yes? Okay, and then we can just talk about nipple care for a minute with her because she is breastfeeding. So it's important that we tell her about nipple creams if needed, because just one bad feeding can cause her nipples a lot of pain. So it's important that she does keep care of her nipples. That way she can continue breastfeeding if she wants. Okay, that's all with her breasts. But while I'm here, is it okay if I go ahead and listen to your lungs? Her lung sounds are equal and clear bilaterally. And then I'm going to go ahead and listen to her heart as well. Her rate and rhythm are good. And now I'm going to move on. Sarah, is it okay if we lay you down here for a second? And I'm gonna be covering her back up. Okay, I'm gonna lay her down. I'm just gonna be looking at your uterus, but before I do, I'm going to listen for bowel sounds. Okay, she has active bowel sounds in all 4 quadrants. Okay. Now I'm going to be doing checking her uterus. So Sarah, what we're looking for here is a firm uterus. We're gonna see where it's at and making sure that she has, make sure that it's firm and not boggy. So I'm gonna take the bottom of my hand right here, and then the top, I'm going to come up here and feel for her fundus. After I feel it, I can feel it and palpate that it's very firm. So Sarah, this is important because if your uterus wasn't firm, that could indicate some problems regarding bleeding. So if you notice that your fundus does become boggy for a period of time, you should notify us so we can come look at that for you. So I'm palpating that. And then I'm also noting that her fundus has shifted slightly to the right, and it's above 1 finger breadth of her umbilicus. And she also did tell us that she voided 3 hours ago. So now I'm going to inform her that if she does go void now, this will most likely fix the problem. Sarah, sometimes, often, whenever you hold in your bladder, it can cause your fundus to actually shift slightly, which can cause you some pain. And after you do go void, it quickly shifts back. So it's important that we keep track of when you're voiding so that this doesn't happen. And then I could help her go to the bathroom now or after. Okay. Moving on, I'm going to go ahead and, since I have her gown down, look at her bleeding, seeing how saturated her sanitary pad is. Looks like she has moderate amount of bleeding. Sarah, can you tell me when the last time this was changed? About an hour ago, so that's good. She has no clots in here. Sarah, just a reminder for you, right now, since you just gave birth, you can tell that the blood is bright red, and this is going to change within the next few days, and it's going to go from bright red, and it's going to get darker, and it's going to look brownish, and eventually it's going to be white. So if this ever regresses back, if you are having brown blood and then you suddenly start having red blood, that's a sign that you should give us a call. And then also check for clots. If you ever see any golf ball sized clots, make sure you give us a call, because that could be a sign that the placenta isn't all the way out, or that we might have some problems, so we should get you assessed. And if I could please have you roll to your side, and I would put on some gloves. And now I'm checking her her perineum, and I'm looking at her laceration. It looks stitched together. It's well approximated. There's no draining. There's no redness or swelling. And then I'm also gonna go ahead and check for hemorrhoids, since she's already on her side. And she has no hemorrhoids, so we're good there. I will move her back and then cover her up. And then I would go wash my hands. Now what we can do is go ahead and check her lower extremities. So we're going to be checking for DVTs. We're gonna see if her legs are hot and red. We'll just see how they look, if one looks bigger than the other. She did have a epidural, so we're gonna check and see if she has gained feeling back in her legs. Sarah, have you been up and walking yet? She said that she has. Have you had any tingling in your legs? No. That's good. And then if we did want to check if she hadn't been up, she can just put her feet onto the bed and see if that she can lift her bottom up off of the bed. We're also going to be checking for edema right now. It's going to be pretty normal to see some, but we're just going to make sure that there's no pitting edema, anything that's very alarming. And then we can also teach her that she can check for this herself at home. And then during that, I also would check her pulses to make sure that I felt them. I'm going to ask her if she's had any dizziness or spotting of her eyes. Have you had any of that, Sarah? No. Okay, good. And now we're going to lower her bed. We can see that she now is asking to hold her baby. She is in a great mood. I'm gonna ask her if she needs anything from me. Do you need anything, Sarah? No? Okay, I'll be back in about 30 minutes to check on you again. Here is your call light if you need me before then. And then I'm just going to wash my hands, grab my things, and then I'm gonna go document my assessment.